Does everybody have the ability to benefit from manual therapy if they're in pain? And let's include, if you could talk a little bit about the potential psychological benefits, a la placebo effect.
Mhm. Yeah. So I don't actually think that everyone will benefit from manual therapy. And the reason why I say this is because there are some patients that cannot modulate their own pain. And that's going to be troublesome, because those patients that we see with 6 months plus of pain who may have a centrally sensitive nervous system. We hear of central sensitivity in the literature and physical therapy and medicine, where I think it's now 1 in 3 people in this world have chronic pain, or maybe 1 in 4 people. And those patients may not do best with a manual therapy treatment. It's just because they can't really modulate their own pain. And the way that the structure of the nervous system is, there's neuroplasticity where they can't modulate their own pain like someone like ourselves who aren't in pain. So I still use it. I'm still a heavy manual therapy utilizer. And I try to make manual therapy as adjustable as possible, where I try not to make people rely on it. I try to use it and then do something else so that I could get someone to modulate their own pain. But yes, I don't, even in my anecdotal thought process, I really don't see everyone benefiting from manual therapy, especially with those patients who are having a hard time modulating their own symptoms. That being said, manual therapy does have a profound placebo effect. And when we think about a placebo effect, we can't think of it in like a randomized controlled trial where you either get an active ingredient or you don't get an active ingredient. This is more of, when we think about a placebo, we really think about a mechanism where our effectiveness of manual therapy is driven by expectations and conditioning. Those are the two big, I would say, psychological or non-specific aspects on how manual therapy benefits people. Because if someone is coming into your office, they're getting a very skilled treatment by a highly skilled provider. And we're basically teaching these patients what they should expect. So we're telling them that this is going to be an effective intervention for their pain. They either have known someone who has benefited from physical therapy or manual therapy, or they themselves have benefited before. So when we think about a placebo being a mechanism on how manual therapy works, it's really driven by those two factors. And there's really more detail that we could go into based on someone's expectations, because there's literature now supporting that how we speak with our patients could actually change how that intervention worked. And conditioning too. If someone is conditioned to expect an intervention to be effective, they likely will have an effective intervention. So it's really interesting on how non-specific effects can impart a positive effect for patients when it comes to manual therapy.